So I want to thank you for joining us and welcome you to this evening's program. I'm Jamie Seward. I am Associate Director of Affinity Engagement Programs with the Office of Alumni Relations. And before we proceed, I'd like to acknowledge all of you for being here tonight and to thank you. So before I turn the program over to our moderator, I encourage you to ask questions by typing them in the Zoom Q&A at the bottom of your screen. We'll have time to answer your questions during the program, possibly after the program. So this is meant to be interactive. So now I have the pleasure of turning the program over to our moderator, Lorraine Hutzler. Lorraine is the Associate Director of the Center for Quality and Patient Safety at NYU Langone Orthopedic Hospital. She's also a founding partner of Labrador Healthcare Consulting Services, focusing on assisting medical facilities and physician practices. She also teaches healthcare management courses as an adjunct professor at NYU and is a reviewer for the Journal for Healthcare Quality. Lorraine, I don't know when you sleep. She holds a BA in economics from Johns Hopkins and a master's of public administration and health policy and management from NYU. She is also Lean Sigma, Six Sigma certified. So kind of amazing. It's nice to have amazing women here today. So I will turn the program over to you, Lorraine. I will disappear myself, and I look forward to hearing what you discuss. Thank you.
Thank you so much, Jamie. Welcome, everybody, and thank you for joining us tonight. We're thrilled to have Tobi here with us. Tobi, could you tell us a little bit about yourself, about your company, and your Hopkins connection?
Sure. So I'm the founder and CEO of Ilekun Helath, which is a company that empowers patients to find the best health provider for them. The way we do that is we use AI to crowdsource information from patients, such as claims, et cetera. We also look at open data around disciplinary action or a number of years providers have been in practice, that kind of thing. And we source information to expose things like the services that a provider offers, the cost and quality. And so essentially patients are able to compare and contrast across providers in the same way that you can imagine the level of transparency you would have in trying to find a restaurant on Yelp or trying to find a repair person on Angie's List. My Hopkins connection is that I studied applied math and went to grad school at Hopkins in the engineering school.
What initiated the development of your company? Was there something specific that happened to you or someone you know? How did the idea come about?
Yeah, so it was a mixture of things. I personally had a lot of frustration in terms of trying to find a healthcare provider. In fact, I was looking for a physical therapist at one point and went to my insurance website, searched by zip code, saw the results, and then ended up having to cross-reference with something like a Healthgrades or WebMD, et cetera, to get a sense of the reviews and give myself a quality kind of indicator for the care I could expect to receive. And then I wanted to understand the pricing. So I started looking at provider websites, if they had websites, and trying to find cost information there. Indeed, they didn't usually have any cost information. And so I just would go to these providers and try my luck. And unfortunately, a lot of times I would get surprise bills. I would not like the care I was receiving. And I felt that, was there a way for future me to not have to go through this issue? And, the same issue that other patients were facing, other friends and family, they were having this problem as well. And so I brought my 10 years of AI and data experience and actually solve this problem. And so Ilekun was a solution that I wish I had all those years ago. Well, not actually all those years, but just, in the past, to enable me to really have really basic information at my fingertips and be empowered as a patient in terms of figuring out who I entrust my health to, because that's a really important aspect of my life, more important than online shopping or dining out at a restaurant.
What was the process like bringing the product to market? What kind of research did you do to see that there wasn't anything else viable that was very similar to your idea?
Yeah, so I mentioned things like health grades or WebMD, and those are places that people today already go to find their healthcare providers. Um, I also talked about going to the insurance website. That's also a place that people find healthcare providers. And so um, we did a lot of market research to understand how people are solving for this pain point. And oftentimes, they kind of just deal with the status quo and they don't solve for it. Um, and the other thing too, in terms of bringing the product to market, we've just finished our MVP and are literally in the process of bringing the product to market right now. And so the things we're looking at are testing the actual geographical market. So we're looking at places like LA, New York, San Francisco. We're also testing out the specialties. So, for example, the three medical specialties are providers of cosmetic procedures. So, for example, dermatologists, plastic surgeons. We're also looking at women's health providers, for example, midwives, obstetricians, and then also mental health providers. And in that case, it would be psychiatrists and therapists. And so, um, basically, it starts out with, you know, um, the market research, and that is often looking at databases. I actually wrote an article on this on built-in, and so there are research databases out there with data. There's just keeping in touch with the sort of industry in terms of being subscribed to newsletters and reading journals. Um, and so from there, that's how we decided on kind of that sample space to test. And moving forward, it's really just a matter of getting it in front of real users and getting that real live data after kind of like whittling down some hypotheses that we think are reasonable.
And tell us a little bit about AI. How did that come into influence how the product was developed? And then what you're doing now, utilizing AI to help individuals that are going to be testing this.
Yeah. So the idea is that my background, you know, I think I had mentioned that I spent 10 years in the data and AI space. And so that's literally my professional skill set. And so um, that's why I think having that frustration and having this background and skill set, they intersected, and it was that I can use this skill set to solve for this problem. And so I mean, perhaps there are other ways, right, that people can go about it. For example, you can get a referral from a friend or family member, and that has no tech involved. The only problem is that it's not really scalable, and it kind of relies a lot on luck, right? You kind of have to just hope you have a big enough sample size in your network in terms of people who have experience with other providers, and or hope that they bring them up, or like your friends and family brings up these experiences or recalls. And so there's sort of a lot of serendipity and randomness in that. And so with tech, we can really scale out that ability to bring trusted information to patients. The AI is also involved in things like the way we analyze the data. So our value add is not just around the fact that we're able to use AI. That's sort of like a table stakes in some ways. It's really that we're able to aggregate information that is very hard to find. So it's very hard to find pricing information, or it's very time consuming to find information around quality and read reviews and things like that. So we're aggregating that hard to find information. And then the AI is really to make it consumable. to make that data human readable and useful for patients. And so, for example, when we're surfacing pricing and costs in this very straightforward, easy to understand way, it's because we've actually done the heavy lifting in terms of the analysis. So for example, we can analyze the reviews that patients are writing, photos that they're uploading, claims that they're uploading, bills, and we're not going through payers, we're not going through providers for pricing information. We're actually harnessing the power of the masses through a crowdsourced / open data approach. So open data around things like years of practicing that a provider has, or disciplinary action. And from the reviews, we're using methods such as natural language processing, and we're able to really extract things like, I healed really well from this procedure, or the provider was half an hour late. So things that are more factually based, giving us an objective quality metric, as opposed to today, all we have is the status, all we have is average stars, which is just an arithmetic mean, completely subjective. So it's not just about, I like the provider, I didn't like the provider. We're telling you something that is basically meant to be used in the same way a FICO score is used for credit worthiness. So being that objective in terms of the kind of insight we're providing to patients on quality and pricing.
And do you think the quality metrics that are being tracked with your product are going to be changing what's out there with Hospital Compare and CMS and the different ratings organizations?
Yeah, that's a good question. I definitely think that there could be some interplay between the two, or between, say, external and my company's way of assessing quality. It seems right now, I'm not a healthcare expert. I think that's your domain, Lorraine. Regardless, my understanding of it is that a lot of these healthcare metrics are more of a hospital-based healthcare metrics as opposed to at the provider level. So our metrics are reflecting overall this provider, how are they overall, and then going even to the micro level, going in depth to look at how are they administering certain procedures. So say I'm a plastic surgeon, overall, maybe I have a quality metric on Ilekun Helath as 9 out of 10. And then if you look at, say, Botox, maybe that's only a 7 out of 10 for Botox. But if you talk about rhinoplasty or nose job, I'm a 10 out of 10 there. So really giving you that fine grain information. I think that, we could have something more comparable to what CMS is doing, if we were to basically take the provider level metrics that we have and combine them, say, if we have multiple providers at a practice or multiple providers at a hospital, to get something that is, as high level as a hospital-based quality score. So they could in the future, actually, we're going to be licensing out our data. So, and we're hoping to work with government entities such as like the Veterans Affairs or even like health centers. So there could definitely be more interplay in terms of, assessing and monitoring health organizations between Ilekun and, the government in the future.
Thank you. That was very insightful. What are some lessons that you've learned from development of your own product and company that you can share with others who are out there that are looking to bring their idea to market?
Sure. Definitely it's about research. So kind of one of the things you asked me about already. I think that if you're getting ready to launch a product or, invest a lot of time and energy in something, you want to make sure that it's something that not just you as a founder or maybe just a handful of people have a pain point with. It should be something that has a large market. So that's number one. And I think that there are a lot of different ways to start businesses. Some people will have a part-time job and then, or sorry, do have the company like part-time on the side and then their main job, or they sort of, go all in and, just quit their day job and whatever. I would just say, like, make sure to not just prepare from the market point of view, but prepare from a financial point of view and really understand, depending on which approach you want to take, make sure you understand how to finance the business.
Thank you. Do you have any pointers as far as finance that you would advise others on?
For me, I'm self-financing it, so it was a matter of spending some time saving up. I also have some sort of minor sources of income that I derive income from. So I do speak on the side and give trainings. So I speak on things like technology, AI, diversity, and then give trainings on and write about AI. So, for example, I don't know if we can share that, Jamie, maybe after, if people are interested in the article I referenced earlier, but that's some of the those are some of the ways that I not only I guess inform others and help others stay you know up to date on what's going on in the space of health technology. It's also, to your question, it's also a way for me to supplement my savings and, keep financing the business.
Fantastic. That's wonderful advice. Thank you. Can you tell us a little bit about, your article that was recently published in Built In, the 4 different ways to innovate in today's healthcare space?
Yeah. Is there a particular thing you would like to know about that
Um,
article?
Why don't we
'Cause it's
maybe
a
tell
long
the audience
article.
about, sure, some highlights of the article, keeping up to date on the latest trends, how to stay connected, and then maybe what everybody's learned.
I think the question's still probably too high level in general. I think that basically what I wrote in the article was just my tips for staying informed in the health technology space. And yeah, it was just kind of like pointers for people to get, you know, people as in really, I think it was really more targeted to other founders in the health space and just lessons that I had learned with my company, some of which I think I've already been discussing now.
Thank you. It doesn't look like we have any questions from the audience at this point in time. Is there anything else that you'd like to share with the group before we turn things back over to Jamie?
No, I mean, yeah, I think that's, if people don't have questions and you don't have any other questions, I don't have any specific thoughts because I'm not quite even sure who's in the audience.
Okay. Oh, we actually have one. Oh, there's one of the attendees wanted to know how somebody can access the session without internet. We're going to be sending out a copy of this recording for anyone that's interested, and Jamie will be in touch with the group in regards to that. So thank you so much, Toby, for your time tonight. I'm going to pass this back to Jamie.
Sorry, actually, I'm rereading that question, and I think they're asking how would they access Ilekun service or product without internet access. So that's a great question, Anita. Thank you for that. The idea is that we honestly have not thought enough about older adults. our target market is really 18 to 55 because of that online presence, that strong online presence that we have. I do think that that is an opportunity in terms of us reaching older adults who don't have internet access, or just in general, people who might not necessarily have internet access. And my short answer would be perhaps in the future, we could look into SMS or solutions that just require you to have a phone. Yeah, I would have to think more about that. I'm also curious, maybe offline, if you could let me know if you feel that older adults are having this pain point of maybe having difficulty finding healthcare providers, because my understanding is a lot of them are usually on Medicare. So perhaps there's already a lot of, cheap, affordable care for them at a decent quality. So Anita, I'd love to talk to you more about that question. And then I also see another question in the
Yeah, it's
chat.
from anonymous attendee.
Yeah. Do you want to read it or?
Sure. What advice would you give that's helped you continue running your startup during COVID?
Okay. Yeah, that's a great question. Funny enough, the company is actually only 7 months old or so. 7.5. We started in the middle of COVID. And I think when you're sort of birthed in the middle of calamity, that's all you know. And so there isn't really like, well, things were so great before, now it's this. There actually have been a lot of pros for having started in COVID. So, for example, a lot of contractors we've brought on have been people who needed something in between jobs to do. And so we've been able to get really great talent, which we would probably have to have, we'd have a lot more difficult time recruiting or, enamoring people like that. But, there was an opportunity because they were, the unfortunate circumstances of the pandemic. And so we've capitalized on that. Real estate's also been really low. I actually recently moved from the New York area to the Bay Area. And even though New York is quite expensive, the Bay Area is actually generally a lot more expensive than even the New York area. And with COVID, though, and a lot of people have exited, and that has caused the real estate market to actually be depressed, and things are 20%, real estate's 20% cheaper. And so that's been helpful for us as well. VCs, investors are also super available because you're not necessarily traveling to have coffee with them or traveling to meet them. They're not traveling to get to work. So, the travel time is time that they freed up to talk to more startup founders like myself. And so actually, COVID has really been, in a number of ways, great for us so far. It hasn't really been a negative impact. And so I guess in terms of advice, to be more direct about the question, I think it's hard for me to give advice because it's not necessarily, it really would be industry specific and product specific. Our product is digital. So everyone that I'm working with naturally can be remote. COVID or no COVID, like a tech company is just very easy to make remote and distributed. And yeah, it really depends on your industry. Healthcare is something that hasn't been impacted with COVID. In fact, there's much more need for healthcare services, and healthcare, say, for example, even telemedicine has actually been doing better with COVID, that industry. So yeah, I don't know if I can necessarily give any specific advice, but that's been my experience as a healthcare tech founder.
Thank you. We have another question. What type of market research do you recommend when identifying how large a market your product may have?
That's a good question as well. I think again, it also I don't want to seem like I'm trying to deflect the questions. I think that the type of market research depends on your product and your company, what you're trying to launch, the industry, that kind of thing as well. I will say, in my experience, and this is some of what I shared in the built-in article that Lorraine was asking me about, some of the recommendations I gave is just keeping up with the industry trends. So whether it's joining their mailing list or going to events that they have, I mean, that's going to be harder now with COVID, but we still have virtual events. The other thing too is just looking at the databases that exist. So a lot of institutions, typically you might have to pay a little bit of money to get access to these databases. So IBIS is one example. There are a lot of societies. So for they're societies that have journals. So whatever industry you're in, they will likely have like the Association of Physicians or something like that, and they'll publish journals, or like the American Dental Association, they'll publish things as well. So those are some maybe two actionable ways of finding market research. But I would also say that don't forget about talking to your potential target users. So we've done a lot of customer interviews, and we've had one-on-one conversations with people who we have identified as having this pain point of having a really difficult time finding quality providers that are affordable. And so talking to them and saying, well, how have you solved this problem? What are you doing? Things like that are other ways of gathering market research. And I think that latter point, unfortunately, making sure that you're actually building towards what your customer needs and wants. A lot of founders often forget about that. So definitely make sure to stay engaged. And even as the company continues to grow, we will continue to make sure that we are staying in touch with the problems that consumers are having or customers are having, and keeping abreast of the industry trends.
Fantastic. Thank you so much, Toby. So that answers all of our questions for now. Jamie, I'm going to turn things back over to you.
Thank you so much. Can you see me or hear me?
We can. Yes.
Yeah.
Great.
See you and hear you.
I appreciate your time. I think you did a wonderful job, both of you. So we'd like to thank you for joining us for our webinar too, to our attendees. A follow-up email will be shared with you following the webinar that will include a recording of the program along with some resources and our event schedule. And I can share the articles with you as well that Toby involved in. Really appreciate your time. Thank you. Have a lovely evening. Be safe, be happy, be healthy. Take care.
Jamie.
Thank you, Jamie. Thank you, Toby.
Bye,
Thank you,
everyone.
guys.
Thanks, Lorraine.
Good night.